Dear listeners, welcome to the NECOcast podcast, where we discuss impactful and pressing environmental concerns. On this episode of the podcast, we are in conversation with Dr. Gayatri Suresh, and the topic of today's discussion would be antimicrobial resistance.
All right. Very warm welcome to all the audience. Dr. Gayatri Suresh is here with us for the inaugural session of the podcast session that we have started. Dr. Gayatri Suresh has completed her graduation and post-graduation in microbiology from Delhi University and University of Pune, respectively. Post this, she obtained her doctoral degree in environmental biotechnology from the University of Quebec in Canada. She has worked in government as well as private institutes in India and Canada, and her research experience spans the fields of drug resistance, tuberculosis, therapeutic proteins, and emerging contaminants. Her passion lies in the area of antimicrobial resistance and its eventual ramifications on human health and environment. Currently, she is working as a research associate at All India Institute of Medical Science, New Delhi, where she is studying the prevalence of emerging contaminants and endocrine-disrupting compounds in aquatic resources based in Delhi National Capital Region. Well, I must say the intro of Dr. Suresh is a very humble one, and her achievements are indeed an inspiration to many of us working in this field. Dr. Suresh, well, it's our great pleasure to have you here on our podcast show. A very good afternoon to you, first of all.
Thank you, Dr. Kumar. And I must say, I was very impressed by this idea that you're planning to have these podcasts. And I'm very, very honored that I will be a part of this first podcast. So thank you very much.
Thank you, Dr. Suresh. All right. So for our audiences, as the title shows, we are going to learn and interact with you, Dr. Suresh, about the antibiotic resistance. What little we know about the antibiotic resistance is that they occur when bacteria, virus, fungi, and even parasites, they do change and evolve over time in our infected body, and they no longer respond to medicines. Well, such phenomenon increases the risk of, disease spread, severe illness, disability, and even death. It will be quite okay to say that their emergence and spread are accelerated by human activity. Well, mainly looking at both sides of the coin, misuse and overuse of antibiotics. And when we use antibiotics to prevent and control infections in not only humans, but animals and plants also. Needless to say that these antibiotic resistance has significant cost for health as well as the national economy. Dr. Suresh, you have been working on ABR, which is antibiotic resistance. I'm sure you're going to use this acronym quite a lot in our talk for quite a long time now. And as an expert, what do you have to say about the antibiotic resistance to our audiences who might not be too aware of this so-called hidden pandemic?
So, yes, as Dr. Kumar says, it can be compared to a hidden pandemic. And, the entire facet of ABR is so broad that people really probably might not understand what all ramifications it would have eventually. Like, for example, I'll give you a very small example that during the COVID pandemic, azithromycin and a couple of drugs were prescribed, to probably one person. And I remember there was this forwarded message that was coming on WhatsApp. And it had been forwarded so many times that if you're testing COVID positive, here's a list of medicines that you have to have. And it has, paracetamol, vitamin complexes, blah, blah, blah. And one or two antibiotics which were probably prescribed just to that person for a specific set of symptoms. And it is so rampant that we see in India, if somebody has, let's say, a throat problem, they just go to a pharmacy and then they say, okay, I'll have one strip of azithromycin. Or if someone has a stomach upset, they immediately ask for a strip of Norflox. And the problem really starts over there when people, first of all, when they try to self-medicate, because as Dr. Kumar said, that antibiotic resistance, it actually comes under a bigger umbrella of antimicrobial resistance. So, infections in humans can be caused by bacteria, by viruses, by fungi, parasites. So, like, logically speaking, if you have a bacterial infection, you would take an antibiotic. If you have a fungal infection, you take an antifungal. If you have a viral infection, then you take an antiviral. But if you take an antibiotic for a viral infection, it is not going to have any effect with respect to treatment of the infection. So, a lot of the spread of, or the emergence and the spread of the antibiotic resistance comes from a very casual use of antibiotics, especially in developing countries. So it's a big issue that needs to be addressed, because antibiotics they are so essential to people, not just for treating infections. If somebody's having, let's say, a joint replacement surgery or any kind of surgery for that matter, you need to put them on antibiotics so that they don't have any kind of secondary infections. So if you're actually breaking down that defense line that we have, it has a much greater negative effect than people can probably imagine. So according to a WHO report, it's estimated that by 2050 there could be about 10 million deaths just just attributed to antibiotic resistance, which is a huge number. So if you think of it in terms that people are dying of infections for which medicines are not working, it's really something big to think about.
Can you please elucidate the potential implications on both human health and the environment, like regarding the environmental concern that we are exploring today, such as in the context of public health, that what are the primary health risks associated with the environment factor under discussion, or subsequently in the context of environmental aspects, what are the direct and indirect consequences the environmental concern that we are exploring today poses to ecosystem, biodiversity, or overall environment stability?
Okay, so about 70% of any antibiotics that you consume is going to be excreted unmetabolized. Only 30% of the total dosage is metabolized in your body. So the remaining 70% will come out in the waste, such as in the feces or the urine. So all of that is going to the sewage treatment plants, and most of the sewage treatment plants, they're not really equipped to kind of degrade the antibiotics before the waste is discharged into the environment. So whatever you're eating now is eventually going to go into the environment. And antibiotics have been classified as an emerging contaminant in the environment because they can get accumulated in the let's say if you have a wastewater discharge that is going into a water body, so you will find antibiotic residues in the water body. You will find the antibiotic residues in the in fish, for example. And eventually it is a cycle that all comes back to the human. So when you have an antibiotic resistance genes, when they are present in the environment, that I'd like to go into a little bit of microbiology over here, because so bacteria have a mechanism of horizontal gene transfer. So when genes are transferred from one generation to another, that would be a vertical gene transfer. But bacteria can transfer genes from one genus to another. So if you have an E. coli, it can transfer its resistance genes to, say, a Klebsiella. So right now in the environment, you have created a resistant Klebsiella because it has got these resistance genes from the E. coli. So there could be a generation of a wider range of resistant bacteria, which can again cause infections in humans. And additionally, another big aspect when it comes to antibiotics and the environment is the use of antibiotics in animal feed. So in animals, antibiotics can be used either to treat infection, and more commonly they are used as growth promoting agents. So if I'm a chicken farmer and I want my poultry to be gaining weight fast, because that will mean more profit for me. So I will give them a low dose of antibiotics, and it has been, it's been a practice for several decades now, that that low dose of antibiotics is actually going to increase their body weight. But again, when if there is, let's say, wastewater that is coming out from these animal rearing places or from the poultry litter, again it will have these antibiotic residues, it will have these antibiotic resistant organisms and consequently antibiotic resistance genes. So it is all eventually going into the environment.
So, ma'am, if we are talking about the antibiotics right now, Asian countries where these antibiotics are available over the counter, and there are no limits that how much you are going to prescribe or how much is somebody going to buy. So, could you please elaborate current state of these antibiotic-resistant genes and the most effective strategies for mitigating their impact in the healthcare and the environment?
Okay. So as all of you will be aware, it is very easy in India for us. We don't even need to have a prescription from a physician or a doctor. We can just go to a counter and say 1 strip of ciprofloxacin. Okay. So as I had said, this is one of the major reasons that is responsible for the rampant spread of antibiotic resistance here. Now the government has started to take some action against this particular problem. So we have a national action plan for AMR, for antimicrobial resistance, and it deals with several aspects. So the main primary aim of this is to create awareness amongst the people, amongst the general public, that you don't go and buy antibiotics on your own. You buy antibiotics only when it is prescribed by a particular physician. And if it is a 5-day course, you complete your 5-day course, because non-adherence to a prescribed dosage or prescribed course of antibiotics, it has been one of the biggest reasons for the development of drug-resistant tuberculosis in India. Then another aspect of this National Action Plan is surveillance. So there is a strict need of surveillance of the dosage of the antibiotics, how much of it is prescribed, if the correct antibiotic is prescribed. It will be easier, let's say, in a larger hospital, but focus also needs to be given on to the tertiary care centers, or you have these small health centers in rural areas. So an active surveillance needs to be done as to how the antibiotic is prescribed to the patient. Then another key component is the prevention of infections. So in effect, you are kind of reducing the amount of antibiotics that is to be given. If you're preventing the infection, then you're not prescribing antibiotics. Then, as I had mentioned, that antibiotics are used not just in healthcare, but they're also used in agriculture, they're used in animal husbandry. So there have to be more efforts on optimizing the use of antibiotics in all these sectors. And of course, the key component of would be for the you invest more into research and development. You look into newer avenues, either into the development of new antibiotics or into alternatives to antibiotics that can be used. So these are, when you talk about policy, so these are the major things that are being looked at by the government. But obviously these things take time. So let's hope that things will get better in a few years.
Thank you, ma'am, for your insights on the policy framework that you just discussed. We got to know about the National Action Plan for AMR, as you described, awareness, surveillance, and prevention, and also optimizing the use of antibiotics in animal and agricultural farming. Ma'am, so these are broad topics as of now, where we see India is right now. Ma'am, we are just running a rat race towards best production and increasing our GDP. So, how far do you see are these goals of raising surveillance, prevention, and optimizing the uses of these antibiotics in general? Also, ma'am, a new field is upcoming. What I hear is that environmental friendly antibiotics are being discussed worldwide, especially by the UN, that could be a possible remediation towards antibiotic resistance genes. What is your say on this, ma'am?
You see, when you talk about a nation's economic development and GDP, it is essential to look at the role that AMR plays over here. So currently, it has been estimated that the loss to GDP due to AMR lies between 0.4 to 1.6%. And this is in terms of death, in terms of disability, in terms of increased health care expenses, the loss of productive working hours, etc. So, which is why tackling AMR has been an important agenda of the government. And that is why they rolled out the National Action Plan that I talked about. But of course, there have been certain challenges with respect to effective implementation of the NEP, such as there have been funding issues, there have been issues with respect to collaboration between the various sectors that are involved, such as the health sector, the food production sector, the environmental sector, all of which are being worked on. And there has been progress with respect to this. So, for example, the ICMR had initiated several surveillance and research centers aimed specifically at AMR. And the data obtained from these centers helped us to gain certain insights with respect to the pattern of drug resistance in common or prevalent pathogens. So this kind of a data would eventually be helpful in formulating policies with respect to antibiotic usage. So as I mentioned, it is a work in progress, and these things take time. Now coming to the second part of your question, that is green antimicrobial. So this has been an active area of study for the past few years. And presently research is being carried out in multiple fields, such as the use of natural extracts from plants or from seaweed, the identification of novel microbial isolates, which would be a potential source of new antimicrobials. Then the use of broad spectrum antimicrobial peptides is being looked into as an alternative to antimicrobials. And studies are also being carried out on the use of green chemistry techniques. This is for the synthesis of antimicrobials which have a low persistence in the environment. So in a sense, you're talking about decreasing the environmental load of antimicrobials. But again, till we have a safe and effective alternative, the only way forward is the judicious use of antibiotics.
So, ma'am, we are at the helm of it. We are doing research and development in this field. We are currently researching on this topic, but we're just working on a lab scale. You have worked and have much more experience as compared to us. So, ma'am, what would you say that would be pressing topics for India right now to work on the fields, and how do you think we can raise awareness along with researching these topics at a much broader domain, such that we're actually able to make an impact on the growing problem of antibiotic resistance?
So I think the first thing that needs to be done is to prevent the over-the-counter sale of antibiotics. It should not be accessible to everyone and anyone. Even when you're buying veterinary antibiotics, for example, you need to have a specific official document that allows you to buy this much, and you ensure that this is for that use. So if you stop that, automatically the access of the people is limited. So there you can control the misuse to some extent. Then the main thing I think is that we ourselves need to be aware, and we need to make the people around us aware. Like there are so many people who think that, okay, I had a fever last month, and the doctor had prescribed me ciprofloxacin, and I have a fever this month, so why spend that extra money to go to a doctor and get a prescription? That medicine worked for me last month, it would work for me this month as well. So that is the kind of mindset that needs to be changed. Self-medication is a big thing that we need to address. And the third thing, what we can do at our level, of course, is if like I said, adhering to the antibiotic dosage. Like if it is prescribed that you have to have it for 5 days, you do not stop after 3 days, even though symptomatically you start feeling better. Because that is what it's again, like I had mentioned, it is one of the major reasons why India has the leading number of tuberculosis deaths in India, in the world, because people don't adhere to the prescribed regimen of the drug. Just for creating awareness, there are a lot of programs that are in place. For example, there is a National Antimicrobial Awareness Week. So these are just things that can be probably implemented in different universities, or in educational institutes, to increase the awareness amongst students and a general population as well.
Okay, so ma'am, can we just talk a little about the global perspective and the collaborative solutions for it? If we just to make it a little simpler, let us say we have WHO, we have international or Indian medical associations where there are medical professionals involved, where there are healthcare policy makers involved. So is there a thing in which antibiotic resistance can be called a global issue? And could you please discuss efforts and collaboration across the nations or healthcare sectors aimed at specifically combating this problem, or what innovative approaches in terms of supplying of these medicines, or creating policies or being explored to address the antibiotic resistance? Because I'm sure this is not the problem for India alone. This can be a problem for such nations which are still developing or still coming out of such problems. So can there be such developments in terms of strategies and policies to find new alternatives for this antibiotic gene resistance thing?
Yes, so WHO has a plan of its own. It's called the Global Action Plan on Antimicrobial Resistance. So this was adopted in 2015. So the National Action Plan of India, it's basically based on the objectives of the World Health Organization's GAP, the Global Action Plan. So as I mentioned, so what they are looking at is, again, the improving the awareness, strengthening the surveillance to reduce infection control, optimizing the use of antibiotics, and inventions, increasing investments in newer medicines, into vaccines for prevention of diseases, or for development of alternative therapeutic modalities for antibiotics. So it is something that has been happening for a very long time, and I think it needs a kind of global cooperation, because it's not isolated to one single country or one single state or one single district. It is prevalent everywhere. So I think there needs to be a lot more collaboration and cooperation between countries, be it for decreasing the amount of antibiotics that are used in animal husbandry, for example, for animal rearing, or for just a joint effort to develop a newer alternative therapeutic option as an alternative to antibiotics. So it's, like I said, it's an ongoing process. We need to revisit some maybe some older techniques such as sparge therapy, for example, off the top of my head. But yeah, it's an ongoing process.
Well, thank you so much, Dr. Suresh. Wow, it's some talk. It's an extraordinary feeling to have you here, Dr. Suresh, and you rightly highlighted the impact of antibiotic resistance in environment by providing our audiences both a general as well as the advanced perspective and overview so clearly. You highlighted the significance of high antibiotic usage and how eventually it goes back to the environment and affects us that silently. It also felt great that you broadly discussed on the National Action Plan, which is dedicated towards the right prescription of antibiotics, dealing various aspects such as awareness to general public, alternative to antibiotics, and how we could eventually stop and control spreading its influence. We also discussed on how it totally, in totality, basically, these antibiotic uses is affecting the national economy. And we need to place effective plans, policy, and programs, and also a global cooperation, as you suggested, Dr. Suresh, to control, if not eradicate completely, the impact of these antibiotics on our health and environment. I'm sure your talk on this antibiotic resistance would certainly help us to be more aware on this emerging yet engulfed tragic the world is silently listening to. It's our pleasure to have you here, Dr. Suresh, once again. Thank you so much.
Thank you, Dr. Kumar. So I hope I was able to give a little bit of insight onto this field. As I mentioned, AMR, ABR, it's a whole wide umbrella of topics that come under this. So I've tried to be a little bit concise. But if you have any questions, you can always get in touch with me. I would be happy to help.
Wow, you were spot on, Dr. Suresh. And yes, for our audiences, you will see the contact details of Dr. Suresh in our description in the wallpaper, and you can then interact with her. And if you have any questions unanswered or in your mind, then you can directly reach her. I think that would be great, Dr. Suresh, if you are not having any obligations or problems in that.
Absolutely not. No problem.
Okay. So, a great Sunday, and thank you, Dr. Suresh, for this lovely interaction, and wish you a very, very nice day ahead. Bye.
Thank you. Same to you, and thank you so much for having such an interesting interactive session. I had a lot of fun doing this. Thank you so much.